Good evening, ladies and gentlemen, and thank you for once again joining us for another comprehensive press briefing hosted by the Ministry of Health, Wellness and New Health Investment. We have engaged the leaders of various sectors this evening, and we'd like to welcome among us the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, the Permanent Secretary of the Ministry of Health, Letitia Lestrade-Wyke, the National Epidemiologist, Dr. Shaluddin Ahmed, the Head of the Criminal Investigation Department, Superintendent Davidson Valerie, President of the Association of Banks and Financial Institutions, Ilma Irish, and the President of the Dominica Association of Industry and Commerce, Kenneth Green. As always, we'll begin the press briefing with an update from the National Epidemiologist, and that's Dr. Shaluddin Ahmed.
Thank you, Ms. Harry. Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Initiative, Mrs. Letitia Lestrade-Wyke, Permanent Secretary of Health, Wellness and New Health Initiative, Mr. Kenneth Green, President, Dominica Association of Industry and Commerce, Mr. Ilma Irish, President, Association of Banks and Financial Institutions, Superintendent Davidson Valerie, Head of Criminal Investigation Department. Pleasant evening, everyone. I'm happy to say that as of today, the total number of cases remain at 16. So far, 8 cases have been discharged, and the rest are at the COVID isolation unit, and they are clinically stable. I just want to elaborate in terms of discharge criteria. Once anyone who fit the criteria of discharge, which include without any symptoms, especially fever, for 3 consecutive days for 72 hours, and 2 negative test results in 24 hours apart, will determine that the case is ready to go home or to be sent or discharged to home. At this stage, no one needed any ventilator. They are all, most of them are asymptomatic. The 8 recovered cases are being followed up by the primary healthcare professionals. So far, we have completed 367 tests. In terms of per capita, this is much higher than any other Caribbean or CARICOM countries except Cayman Island. Of these 367 tests, 351 are negative. So far, a total of 152 contacts out of these 16 cases have been identified. And of these 152 contacts, 145 contacts have been cleared, meaning they were tested and test results, most of them were negative. Those who are positive, actually they were included in those 16 confirmed cases. Those are negative, they also completed their 14-day quarantine period as well. We have a total of 7 remaining to be tested out of those 152 contacts in order to complete our contact tracing list for these 16 cases. And as we speak, the test should be tested as we speak. It's test already ongoing of those 7 cases, and God willing, the result should be out by tomorrow. So this concludes a summary of number of cases that we have at this stage, and number of hospitalized cases, as we 8 of them at this stage, and number of contacts remain to be tested at this stage are 7. I just want to thank you for your effort and sacrifice that you are making. It has been 8 days since the last confirmed case was diagnosed. So thank God it is working so far. It is working. Your efforts are paying off, and God willing, our efforts will pay off. And I thank you again, and continue to observe the social distancing, respiratory etiquette, frequent hand washing, and stay home if you don't need to go out. Thank you.
And our thanks, as always, to Dr. Shaluddin Ahmed for a very concise presentation, but as usual, very informative. Just to reiterate, we remain at 16 confirmed cases, 8 recoveries, and 8 active cases. Next on our agenda for this evening, we have the President of the Dominica Association of Industry and Commerce, Kenneth Green.
Good evening. I believe protocol has already been established. I'd like to thank the government of Dominica and particularly the Ministry of Health for inviting us to this briefing. The first point that I'd like to make is that this has been a challenging time for everyone, the private sector and the general public, and we continue to encourage both our members and, of course, the general public at large to continue to adhere to the health protocols that are being encouraged. After a shaky start, the private sector has started to adapt to the conditions that have been applied to us. At current, nearly all of the supermarkets, if not all, have established protocols for calling and ordering, and also for encouraging people to utilize online services for their shopping and for meeting their other needs. We are currently in the second phase of a survey amongst both our members and the general business public. And so therefore, we are in tandem with the DHTA about to complete this survey so that we can provide to the government of Dominica to guide their policy decisions going forward. We also want to encourage wider private sector membership who are not members of the DHTA or the DAIC to get in touch with us, either through our email address on daic@cwdom.dm or on 449-1962 or on 235-1962. In terms of the progress that we are trying to make, we endorse the fact that the government have said that they want to take a health-first approach to solving this crisis. This is challenging for all of us. We recognize that every day we are being contacted by businesses who are looking for avenues of flexibility with regards to the current conditions that they operate under. However, as has been identified by Dr. Ahmed, we are making progress in terms of the health-first approach. And the sooner that we can achieve the health goals and get to the level where we can open up domestically, the better for the entire economy and for the general public. Again, we'd like to encourage people, as will be established by the Association of Bankers. We want to establish that the general public should contact their financial institutions to be able to look to get the best packages possible in order to have moratoriums and loan assistance to tide them over during this difficult period. We'd like to thank everyone for adhering to the health protocols, and we want to assure you that the private sector is together with you in this struggle. Thank you.
Our sincere thanks to Kenneth Green, the President of the Dominica Association of Industry and Commerce. As we can all well imagine, financial concerns remain at the forefront of everybody's mind during this disaster. And that's why with us this evening, we have the president of the Association of Banks and Financial Institutions, Ilma Irish.
Thank you, Ms. Harry. I will observe the established protocols. The overall disruption experienced in the financial sector as a result of COVID-19 has influenced changes in some aspects of the way we do business. No longer can we have open counters which were considered client-friendly. Maintain close contact with customers. Notwithstanding, we must embrace every possible opportunity to serve our clients and do so not just efficiently, but professionally as well. For the safety of our staff and clients, we have had to reduce the number of persons accessing the business floor. Request that appointments are made to obtain service, encourage hand sanitizing, social distancing, promote more use of ATMs and the online channels as far as possible. After consultation among the stakeholders, including the ECCB Association of Banks and Financial Institutions, a decision was taken to assist our customers as reflected in a joint press release from the association supported by the ECCB as follows. In view of the projected impact on the individuals and businesses across the region, we have agreed to adopt a collective and coordinated approach to help address the economic and social consequences from the pandemic. Consequently, we have agreed that a support program will be implemented by all member financial institutions in the ECCU. The program will facilitate loan moratorium or deferments for an initial period, a waiver of fees and charges. With the above guidelines, each institution was responsible for creating its own package of assistance for customers and advise customers accordingly. The special accommodation made at all financial institutions are as follows. But prior to indicating, I would like to share with you the distinction between a deferment and a waiver. A deferment is simply deferring the date for payment, allowing the individual client to have more cash flow, whereas a waiver is indicating that you are not expected to pay. In this particular instance, we are deferring payments. With respect to the National Bank, a moratorium on principal and interest repayment for all interested loan customers for a period of 6 months. Business customers are encouraged to talk to the bank regarding cash flow support or other financial needs. The waiver of late fees on all loans and late and over limit fees on credit cards for up to 6 months commencing April 1st. With respect to the Republic Bank, moratorium on all loans, including mortgages and help loans for up to 6 months, will be automatically made available upon request. There will be debt restructuring, temporary increase in overdrafts and credit cards. Late fees on loan payments will be waived. no penalty on withdrawals of certificate of deposits. With respect to CIBC First Caribbean, special assistance on a case-by-case basis to include deferred payments, special loan financing. Clients experiencing challenges are required to reach out to the bank. Royal Bank specific 3 months deferral on credit facilities from March 17, 2020 to June 30th, 2020. Businesses and corporate clients are eligible for relief programs following individual assessment. In terms of the National Cooperative Credit Union, it was or is the policy that a member can be allowed on a case-by-case basis up to 12 months deferment. But specific to COVID, this time of the year, members are allowed up to a maximum of 3 months deferment on all loans. Thank you very much.
And thank you very much, Mr. Ilma Irish, the president of the Association of Banks and Financial Institutions. And I hope he has cleared up some of the concerns. Of course, we encourage you to contact your financial institution directly should you have any further questions. Next on our program this evening, in the wake of a very long lockdown and as we look ahead to the weekend, we invite the head of the Criminal Investigation Department, Superintendent Davidson Valerie.
Protocol having been established, good evening to all. I am pleased to report that the curfew order has been generally adhered to island-wide. For the Easter weekend in particular, a holiday weekend when Dominicans usually flock to the beaches and rivers, it was noticeably quiet. The beaches and rivers and streets were void of the usual activities. This has been the trend since the commencement of the curfew on April 1, 2020. I want to take this opportunity to thank all citizens and residents of Dominica for their cooperation. Notwithstanding the general compliance of the emergency power orders, I wish to remind citizenry of Dominica that the curfew order continues to be in force until May 11, 2020. No person is allowed to be on the streets on weekdays between the hours of 6 a.m. and 6 p.m. without a valid reason or permission from the Commissioner of Police. No persons shall be allowed on the streets on weekends without a valid reason or permission from the Commissioner of Police. The law makes provision for essential workers to be exempted from the conditions of the curfew. All essential workers shall, at all times, carry personal identification. All non-essential workers are required to seek permission from the Commissioner of Police to be in a public place during the curfew. You can now apply online at dominica.gov.dm. Be further warned that for the avoidance of doubt, all bars shall be closed. There shall be no sale or consumption of alcohol in or in the vicinity of any shop, grocery store, or supermarket, or in any public place throughout the period of the order. Also, no one shall host or attend a private party, which includes any person from outside of the immediate household of the house occupant. No person shall host or attend a funeral except 10 members of the immediate family and at least one officiant and essential mortuary staff. I want to remind you that any person who contravenes or fails to comply with these regulations shall be dealt with according to law, the penalty of which will be EC $500 or to imprisonment for 12 months. Let me encourage you to continue to work with the health professionals and members of the Commonwealth of Dominica Police Force with a view to eliminating COVID-19 virus in Dominica. Thank you.
Now, thanks once again to Superintendent Davidson Valerie. To stress a few of the points, no alcohol can be sold. I know there has been some confusion today about a break in the ban of the sale of alcohol. There is no break. It continues. No alcohol shall be sold. Again, the curfew continues. 6 p.m. to 6 a.m. weekdays, and of course the lockdown continues on weekends. Thank you again, Superintendent Davidson Valerie. And our final presenter for this evening is the Minister of Health, Wellness and New Health Investment, the Honorable Dr. Irvin McIntyre.
National Epidemiologist Dr. Shauluddin Ahmed, Permanent Secretary, Ministry of Health, Mrs. Letitia Lestrade-White, President of the Dominica Association of Industry and Commerce, Mr. Kenneth Green, President, Association of Banks and Financial Institutions, Mr. Aylmer Irish, Head of the Criminal Investigation Department, Superintendent Davidson Valerie, and newly listening public. Pleasant good evening to all. We are here again to enlighten you on the present situation as regards to COVID-19 nationally. As you have heard from the epidemiologists, our cases remain the same. Our last positive case was on the 7th of April, and that was case number 16. We have so far traced and tested more than 40 individuals who may have been in contact with this case 16. This extent of contact tracing will enhance our early detection and further isolation. This is actually the most effective way for containment of COVID-19. Today, there were extensive discussions between our Cuban team and primary healthcare team. These discussions were geared at increasing our surveillance at the community level, thereby enhancing our early detection measures. Our rapid testing supplies will be used for serological studies regarding immunity levels in our communities, while our PCR testing will remain for definite diagnosis. This will hopefully prevent us from reaching the stage of mitigation. We are fully aware of the importance of our healthcare capacity, epidemiological information, systems for early detection, and ability to isolate. And by strengthening these, our preparedness will be much improved. This has been done through the supplies that we've received from our international friends, our increased human resource of health workers, our improved capacity for isolation at Portsmouth St. James COVID facility, Apart from the previous measures that I've mentioned for containing COVID-19, we must also not forget physical distancing, wearing protection such as masks, sanitation and disinfection measures, that includes washing of hands and disinfecting our premises, continue to utilize the hotlines for flu-like symptoms, and obviously management of our borders. All of these measures are meant to protect the health of our people, while being sensitive to the economic impacts of this pandemic on our country. The evolution of the pandemic will determine the relaxation or tightening of physical distancing and restriction of movement. We have not called for a full lockdown, and we have no evidence of community spread. However, we are urging the public to please adhere to the physical distancing measures that we've been highlighting over the past few weeks. The government is aware of the fact that such measures may disproportionately affect the less fortunate, and consideration is being given to this reality. This new lifestyle of movement restriction and physical distancing will continue for the next few months. There is no definite time period, since there is great uncertainty regarding COVID-19. We must all recognize the fact that a united approach is the best and the only way to keep our country safe. As much as it may be inconvenient for most of us, we really don't have a choice but to play it safe. Let me extend my greatest gratitude to all our international donors and local businesses and companies for their tremendous support to the fight against COVID-19. I've mentioned most of them before, but the list continues to grow. And I will add to this list Rainbow Car Rental, Universal Elegance, Dominica Red Cross, Den Shillingford, Bullseye Pharmacy, Digicel, Sagico, Shine Union, Silver Lining Car Rental, Jolly's Pharmacy. A special recognition to all the frontline workers for their dedicated approach and great work done so far. And to you, the public, please continue to adhere to the measures put forward by the Ministry of Health, and let us continue to educate and support each other. I thank you, and God bless you.
Thank you very much to the Honorable Minister for Health, Wellness and New Health Investment, Dr. Irvin McIntyre. And with that, we've come to the end of this evening's press briefing. But before we say goodnight, just to reiterate some of the points that have been made for the past few months, we cannot stress enough the importance of proper hand washing. It might sound like something very small. It might sound like something you've known all your life, but we cannot tell you enough how important that is. Also, proper respiratory etiquette. Again, we've been stressing coughing into your flexed elbow or using a tissue and disposing of that tissue after one use. The use of rags, not encouraged. The use of scarves, not encouraged. Tissue or your flexed elbow. And of course, washing your hands immediately after. We cannot stress enough the importance of physical distancing. You heard from the superintendent mentioning there should be no gatherings of more than 10 people and people in the immediate household. Again, we encourage you, no congregating on the streets with your friends and family. You are doing yourself a disservice. You're putting yourself and others at risk. Of course, we also encourage the wearing of masks in public, wearing them properly if you are not sure of how to wear them. There are several videos online. You can go to the WHO website and get that information. Ladies and gentlemen, we thank you as always for your attention, and we also thank all those who took the time out to present this evening. And we ask you to continue to take heed and take the advice from the experts to tune in to all the press briefings and the radio discussions. And we ask that you do what it takes to protect our country, to protect your friends, your family, and your loved ones. Thank you again. Have a good evening.